Good morning. We're going to talk about post-concussion syndrome or traumatic brain injury today. And there's really, you need a multi-pronged approach when you're talking about this. But let's define it first. So what is a traumatic brain injury? And I'm going to read the official definition, okay? So the official definition is that it is an interruption of the normal function of the brain or sensory systems, so that's important, from an external mechanical force such as rapid acceleration or deceleration, impact, blast wave, or penetration, which can lead to impairment of cognitive, physical, and psychosocial functions. So that's the official definition of a traumatic brain injury. And it may interest you to know, most of us think about sports injuries or car accidents as being the biggest causes for traumatic brain injury. But interestingly enough, 47% of concussion or TBI is actually a result of falling. So 47% of falls will end in a concussion of some type or some level. After that, 24% is a strike to the head, whether that's in a sporting injury or an assault. And 14% comes from car accidents. So just to give you an idea of where a lot of these injuries are coming from. There are two different types of concussion. One is the one that we think about, the injury to the cerebrum or to the brain, the bulk of the brain itself, which causes the things like loss of consciousness, memory loss, those kinds of things. But there's also something called a vestibular concussion, and that is where it affects the balance center of the brain. And so people who have this have chronic issues with balance and coordination. So this is an important distinction because we would treat the two different types differently. A cerebral concussion, the type that we're all kind of used to talking about, head injury wise, the one where you might have a loss of consciousness and change in brain function focus. That type of head injury, we tend to rest those people. Stop any of the sporting activities, of course, but rest, sleep, recovery time, downtime, not using the brain constantly, decrease the amount of computer screen use, and just basically resting the brain. However, vestibular concussions really need to be, you need to get those people up. You need to get them using their vestibular system, and so we need to rehab them and move them around sooner. And sometimes, of course, you can have aspects of both, in which case you need someone who is specialized in this type of injury to help you with recovery and therapy in order to improve. When we talk about, and really we should be, honestly, my opinion is we should be pre-screening people, and we should be doing genetic testing, and we should be maximizing brain function before we have an injury. So ideally, especially with sports where we know we're going to be in a position where we could get injured, knowing what your genetics are around your ability to heal your nervous system, where your nutritional levels are, and what types of things you need to focus on to maximize your brain function and your brain's ability to heal before getting injured really will maximize your ability to recover. That being said, if you have not done that and now you have a concussion and you're trying to heal yourself or a loved one, then maximizing a multi-pronged approach and really doing it in the right order is super important. So obviously when you have a strike to the head, there's mechanical issues. And as an osteopathic physician, my first goal is to put the pieces of the brain, put the pieces of the skull back where they belong. So the skull has hinged joints. Even the flat bones of the skull, they have joints in them, and the bones of the face as well have joints. And so when you have a strike to the head, you're going to change mechanically, structurally what's going on. It can also impact the craniosacral, so the neck, the cervical spine, and of course the cervical spine is attached to the thoracic spine, which is attached to the lumbar spine, which is attached to the sacrum, and it's really an entire system of bony movement, of joint movement, that really works all together along with respiration. And so seeing a specialist, or either an osteopathic physician or someone who is highly trained in craniosacral, can be very, very helpful immediately after injury to put things back where they belong, so that the normal respiratory function of the craniosacral system can begin to work again better, which will help obviously with cerebral spinal fluid flow. It will help with lymphatic flow, which helps decrease inflammation. So this is a structural piece of recovery. After this, we need to control inflammation. So one of the first things that happens when you have an injury or a trauma to the brain is you have an increase in microglia. These are lymphatic cells or immune cells that patrol the brain. You're going to have an increase in those in the brain that are also going to release cytokines or inflammatory markers that increase inflammation in the brain. That's the beginning of the healing process. It's normal. But for some people, and as we discussed yesterday when we were talking about genetics, some people can't turn their inflammation off. And so once we have that inflammation there, that starts the healing process, but we want to make sure that we don't leave that inflammation there, because long term that will cause a lot of damage and will impede the brain's ability to recover and heal. So inflammation control is a big piece of healing post-concussion or post-traumatic brain injury. And there's a lot of modalities that can be used. But one of the tools, as you may have anticipated based on our conversation yesterday, one of my favorite tools is knowing a person's genetics, because each person is truly beautifully and uniquely created, and every person has their own genetic code. And when you know the code and you know where your strengths are and where your weaknesses are, you know what you have to do in order to heal. And so when we have I like to do a genetic marker test specifically for concussion that has 30 genetic markers that tell me about the ability of the brain's mitochondria to function, because that's the next thing you have to do. So controlling inflammation, these genetic markers will give me an idea of what the person's strengths and weaknesses are in the immune system and the inflammation control systems, genetically speaking. Also, we need to have mitochondrial support, which is mitochondria are the energy cells. They're the batteries inside all of our cells. When we can't produce enough energy, we can't heal. Our cells can't work the way that they're supposed to. So we have to have mitochondrial function at a high level. And our genetic markers will give us a really good idea of where we are from a mitochondrial standpoint as far as what we need to do to support mitochondria. That doesn't mean that you won't have mitochondrial issues even if you have good mitochondrial genetics, but I'm just saying when you know the genetics behind it and you know where the bigger weaknesses are, then you can find some natural methods and workarounds. The other thing that you need to do is maximize the brain's nutrition. Anytime a body part is trying to heal, especially the brain, it uses a lot of the nutrition up in the healing process. And so if you already have genetic markers that inhibit your ability to bring nutrients to the cell, bring nutrients to the Krebs cycle and the mitochondria, you're going to have a lot of trouble healing, because you need nutrition. So maximizing the nutrition that can help the brain to heal is a really important piece of the puzzle. Also really important is understanding how to know that you've done what you need to do. So having some examination that tells you, okay, there's still a problem with the brain, and then there's a resolution of that problem. Postural testing is a really great tool for this, and different physicians have access to this. And being able to have, ideally, again, pre-screening would be great. If you knew what a person's postural strengths were before they were injured, that would be ideal. So again, pre-screening, it really is where we should be pushing. But once we're injured, being able to follow the postural capabilities of a person, if they're still off balance, if they're unable to be coordinated, there are neurologic exams that we can use to test for this. And when we see these things begin to resolve, we know that we're pushing everything in the right direction. The other thing, obviously, is symptoms. Now, the problem with symptoms is that symptom complaints are really only as good as the patient. And oftentimes with high-level athletes especially, they want to get back out on the field, and they're not going to necessarily tell you the truth. Sometimes they're not going to share with you how they're really feeling because they want to get back on the field. So having a highly accurate, objective measurement tool like these postural tools is a really important piece of it. But also, encouraging the patient to give you their symptoms and to be legitimately honest with you, so that you can follow their symptomatology. And then asking, obviously, family, right? When you're talking to family's going to tell on you if you're the patient. So talk to the families, because if the patient won't tell you, the family usually will, especially the mama. These are really good tools as far as following the symptoms and following improvement. So a perfect example, let me just talk a little bit about a perfect example of a genetic marker that would impede your ability to heal the brain would be a methylation deficiency. And so what that means is that you are unable to take from your food the B vitamins and convert them into a methylated form of B12, folate, and some other chemical constituents that need to be methylated. And when you can't do that, then you can't deliver those B vitamins to the cells for use in the mitochondria to create cellular energy, for use in healing. And so for those people, you need to give them more of these methylated B vitamins. But again, it's really important that you're doing things in the correct order. And so if you have a person who has inflammatory genetics that impede their ability to decrease inflammation, you have to fix that first before you start feeding all of the immune cells in the brain and having them create more inflammation. So it really is a bit tricky, and you really do need to be working with someone who has an idea of how to do this in the right order, because in the wrong order, you can do all the right things in the wrong order and you won't do well. So really is important. But this again goes to that genetic test that is just one of the most spectacular tools. And something that you invest in for yourself one time and it never changes. And it's a tool and information that you can now use for the rest of your life, in any situation, to help you heal from an injury, to help you maximize your performance, to help you improve your immune system so that you're not getting sick as much, or improve your immune system so that you can help your body to reverse some autoimmune disease symptoms. Things of this nature. So there's a lot that can be gained from genetics. And especially when we're talking about head injury, there's a specific set of genetics that we want to know about for brain injury. And so this is something that I do in my practice that I can help with. But there are other physicians out there too who are functional neuroimmune physicians. But you definitely want to work with someone who has an idea of how to use this information for you in the right order. So I hope that helps to explain a bit about concussion, some of the modalities that can be used. Really, the genetics is a huge piece. Once you have the genetics, then you can choose supplements and other types of lifestyle changes or modalities that will be most helpful for you. And really, those of you who know me, personalized precision medicine is really where it's at. And I can throw a lot of ideas at you and you can try them, but whether or not they'll work for you really depends on you. It depends on your genetics and on your body and how your specific body works. So having that piece of information is really the first and foremost thing. That being said, decreasing inflammation is a huge piece of the puzzle. So there are some things that can help with that immediately and actually can be preventative tools. And one of the biggest ones that I recommend to all of my patients is CBD. So a legal, non-intoxicating, meaning no, not with the THC levels that are intoxicating, and legal meaning less than 0.5% of that same THC. So when we can take CBD preventatively, the literature on how it can be neuroprotective is phenomenal, because it improves nervous function, it stabilizes the nerves, it decreases inflammation, it improves the immune system or balances the immune system. It does so many beautiful things for our bodies. So being able to improve our endogenous immune system and supplementing with a high quality organic CBD that's lab tested with third-party lab testing so that you know it's clean and it is what it says it is. Okay, this can be a really great tool, and something that I highly recommend. If there are people here who want to know what I use, please reach out to me personally. I don't want to make this educational piece about selling products or talking about specific products, but I'm happy to recommend in the background if you want to reach out to me. I am familiar with high quality CBD and where to get it, and I'm happy to share that with you. So CBD is an amazing anti-inflammatory or tool for decreasing inflammation and improving brain function. Another thing that you can use that will work pretty much across the board is hyperbaric therapy. The problem with hyperbaric therapy, of course, is that it's highly expensive and very rare that insurance will cover it. But it's always worth making a phone call, finding out who's around you that might have hyperbaric availability. And the way that hyperbaric oxygen therapy works is because it's oxygenating the cells. And when you oxygenate under pressure, it helps to decrease inflammation and it helps to improve function on all cellular levels. So, and one of my favorite things to do is to combine CBD with hyperbaric oxygen therapy. And when you do that, you're kind of you're driving that CBD in deeper into the cells, so that they can utilize it better. And you're combining two different sort of synergistic products. So those are a couple things that can be used pretty much by everyone to decrease inflammation. But there are a lot of tools that I would suggest based on your genetics. So if I'm looking at your inflammatory genes, depending on what I see, I may offer you some other different things. So that would be helpful for you. And I would only offer them to you because I know they're helpful for you, and I wouldn't necessarily offer to someone else who doesn't need it. So it's all about knowing exactly what your body needs, what your brain needs to recover. But that suffice it to say that if you can't get your brain completely recovered and you have another head injury, you will start now compounding the problem. And this is where you get, results like Muhammad Ali and some of these boxers that have had multiple head injuries without the ability to recover in between, and without the correct support to recover. And now you have, permanent brain injury, that lack of ability to function. And that is never where we want to go. So I hope that answers a lot of your questions about brain injury, and gives you some tools that you can use. Talk to your doctors about genetic testing. It is really a huge win when you know the information of how your body works. Then you can know what to do to help it heal. I actually currently have a special going on, a coupon for genetic testing through my genetic program. There should be a link connected to this video that will take you directly to the test. The coupon code is genetics100, and you'll receive $100 off this program. The genetic testing, if you decide you want to do this and you're looking for genetic testing for something very specific, make sure that I know what you are specifically looking for before we order the tests, because I might tweak the program a little bit specifically for you. And if you're looking for it for head injury, I would obviously add the post-concussive or traumatic brain injury genetic panel of 30 different genes to the baseline panel. So that would be a really important thing to let me know. But right now it's $100 off. There are 25 people who can benefit from this. The coupon code can be used 25 times. So if this is something that you're working on and you need help, take advantage of this offer. Take advantage of it, because it really is a powerful tool. And again, it's an investment that you only need to make once in your life, and you have the information after that you can use over and over and over. And in this genetic program, which I talked about yesterday, so you can go and watch that video from yesterday, the program, you'll receive significant genetic, very large genetic panel that is covered by the cost of the program, and you'll receive an hour consultation with my genetic SNP specialist, educating you and recording it so that you have that for life to go back to. And you'll also receive an hour with me where we will talk about tools and how your genetics work for you and what you can use and what you shouldn't use. So what you can use and should use and what you shouldn't use. These are all important things that you will learn from me, and we can even create a plan for you during that hour that will help with whatever it is you're trying to overcome. So take advantage of the genetics program. I will make sure that the link is in the comments or the description of this video below as well, just in case it's not showing on the video. And I hope you guys have a wonderful Tuesday, wonderful rest of the week. I'm so glad to see Laura. I'm so glad to see you on. Hi. I'm glad to see everyone here. I will. I hope this helps, and I'll talk to you guys later. We'll see you next Monday for another scheduled Facebook Live. Bye, guys.